I think we have to remember that kids come into therapy expecting that we're going to try and draw out their feelings. So they're already a little balky, and it's actually the thing that I think we get most made fun of and caricatured. I mean, you know, kids are like, oh, you know, yeah, what are my feelings? I mean, that's what they make fun of us for. And so, you know, there's truth in that. We have to look at it. So when we keep asking about feelings, I think just even the word has something about it that causes kids to back off. Of course, feelings are important, but I think if we can get to them indirectly without asking, how do you feel about that, we're going to keep the conversation going. I think questions like, how do you feel about that, are going to stop it. The kids thinking, what do you think I feel about it? I mean, like, I just told you, or, you know, it feels shitty. What else do you want me to say? I mean, it's, you know, it's not a very helpful question. So that's one thing that I suggest people don't go. And it's just the whole idea of asking a lot of questions. I mean, and then I think sometimes, you know, the kid will say something like, well, you know, what about you? And then the therapist will say, unfortunately, something along the lines of, well, we're not here to talk about me. We're here to talk about you. And the kid's thinking, you may be here to talk about me, but I'm not. I'm not here to talk about me. And you have a real fracture in whatever rapport you had, because it's a way of just saying, you know, I'm not here. And I don't know how you have a real conversation without being there. And I think there's ways to be part of the conversation and part of the process and very noble without being overboard in your self-disclosures or too solicitous in terms of what you tell the kid.
So stay with that. So how do you help us a little bit to understand how you see this, the therapist's presence? So you're saying the therapist needs to show up. They can't role play and a therapist or mail it in. So the kind of question that if a teen client begins to get curious about you and starts asking you personal questions, how do you, in your work, how do you handle that kind of a situation?
I answer them, by and large. I mean, most of the time, they're not inappropriate. I mean, if it's a genuine question, they just want to know about you and what you do. What are the
kinds of things that kids might tend to ask you? What are those that you have?
Oh, I don't know. Well, okay, so in my office, there's a lot of things that will tell, like, what I'm about. I bring my dog to work. She's a big bull mastiff, so she's there. So they might ask me about dogs, and I'll talk about her and how I got her and the story behind getting her, which is a whole other thing, and might talk about my other dogs and how I grew up with dogs and what dogs mean to me and all that. They'll see pictures of me and horses, so they might ask about that. They might ask, they'll see, I don't know, I have toys out, I have stuff out. I mean, I'm there, they can ask. I can't remember the last time anyone has asked me anything inappropriate. And if they had, it probably would have been in that residential treatment center where it would have been done to provoke me, and understandably so. But I would have said, you know, if that had come to me, I would have said to the kid, you knew before you even put the sentence together that I wouldn't ask it. So what are you really looking for? I mean, they know what's okay and what's not okay to ask. So most of the time kids are asking okay questions. But everyone has different levels of comfort with how much they disclose. So, you know, I think there's a way to steer it away or to give a more maybe superficial answer without that blockade of we're here to talk about you, not me. I think just that whole phrase. And, you know, in a sense, that's what I was taught to say with adults, you know, and so presumably with kids too, but it just won't work with them. And I don't blame them. I'd walk out too.